woke up and I had two little boys staring me in the face, and I said, what do I have to offer them? And I knew that immediately I needed to go back to school. Years later, of course, because I was 14 when I had the first and 17 when I had the second. Needless to say, that is years later, but I learned. We have a lot of young ladies that is sitting in our public school system and they're pregnant. And it is an influence on our other young ladies, and some of them are coming back with 2 and 3 children. Their biggest influence is at home. So if they're coming from a mom who had a baby, and then now and all of their sisters have babies, 9 times out of 10, that's the path they're taking. So we try to tell them and educate them on it and let them know about it. But as sad as it may seem, it is what they get caught up in.
How can we get boys educated about sex life?
Okay, I want some condoms, I need to bag them, you know. And they don't even know, they would admit in a smaller setting, they don't even know how to put a condom on, you know, and if they were...
They think they do.
Well, they think they do. So the investment in the education when they're in a non-threatening situation is very, very important.
Yeah, we could tap into those healthcare professionals who are giving these physical exams to these boys to take that, 5 minutes. So let's talk about contraception for a minute. And we definitely talk to boys about their perceptions of fatherhood, because some young men think that being a dad is that's mama's problem. It's not my problem. I'm responsible for paying child support, and that's it. And not responsible for actually raising the child in a safe and nurturing environment.
I think we're probably on the same page. Like, why is this important? Why is access to sex ed important? Well, I think we all talked about like a lack of knowledge, the different issues that come up, not knowing their bodies, not knowing what they're doing, might even create prejudice.
To have support for the adults that are doing this, and peer pressure, media, things like that.
We said life skills would encompass not just sexual health, but an overall domain of everything a child would need to develop into a productive citizen. So that means, yes, they receive sexual health education, but also life skill development in communication, healthy relationships, decision making, goal setting, even financial literacy, so that when they are tasked with making these decisions, they're equipped to do so in a way that leads toward the best decisions, best results for their lives. Some of the key stakeholders, yes, are organizations like us, but also the youth themselves, youth serving organizations, the faith-based community. We understood it would be best fit in the school system, but given the time constraints, it may not be logical to put all the pressure on the school system to take care of the problem. So that's why community organizations play a vital role in getting the message to the youth so that they can be empowered to make the decisions that best lead to their success in the future.